Hello, everybody. Welcome to this episode of our video podcast. Today's topic is baby tooth trauma. And our special guest today is Dr. Kelly Mansour. She's a pediatric dentist, studied at University of Florida, diehard University of Florida undergrad, dental school, specialty, everything. So this is kind of a little bit of a personal topic for me because I'll tell you, out of all the years I've been practicing, there's only a few times that I get parents or patients of mine calling me absolutely hysterical at 3 in the morning, 11 o'clock, all hours of the day. My patients have had my cell phone number since the day I started practicing. It's on the recorder. And I've never had any issues with that, except parents call me freaking out. And I have to share a little bit of a story to bring us into this topic. Just a few days ago, about 3 days ago, my assistant called me up. Her name is Julie, and she texted me. I'm looking at the phone right now. I'm just reading it verbatim. It's 7:30. She says, question, my son fell, she has a 2-year-old son, fell and knocked his tooth loose. It's his lower front teeth and they're pretty loose. And then she said, do you think I should bring him in to see you? And I said, okay, I can meet you at the office in 30 minutes, thinking, okay. So 5 minutes goes by and Julie texts me back and says, I tried to get my son in the car. He's kicking, screaming, and he tried to bite me. And then I replied, oh, well, if he's biting you, then that's usually a good sign that he doesn't need to come to the dentist, and don't bother, and I shut my phone off for the night. So, Kelly, I need to ask you, did I just commit like malpractice? Am I going to jail for this? But, these questions come up all the time, and it's such a huge topic that I'd really like for you to give some insight as to baby tooth trauma. Tell us a little bit about what you tell parents when you see their kids having a tooth knocked out or a tooth loose and stuff like that.
Sure. We see trauma probably just about every day in our practice. It's very common. Oral injuries in children are probably actually they're the second most common injury. So with that being said, we get phone calls just about every day about a child falling on the tile, the parent wasn't looking for 1 second and they fell. And that's a lot of times how we get our first patient, actually. Their first visit
Sure.
to the dentist is usually, because of trauma. But when we get these phone calls, whether we're on call or our staff answers them in the office, we always want the parents to stay calm. Easier said than done. However, if they're able to assess the situation, they can better communicate with us what exactly is going on. And so once they're able to do that and clean the mouth and really see what they're looking at, we can better address the situation, whether it's something that we need to evaluate in the office that day, or if it's something that can be seen, the following day.
Okay, so tell me, mostly with baby teeth, I guess the first question is how old, and I'm talking about front teeth, what's an age range where kids, boys, girls, I'm not sure if there's a specific age range, where they're dealing with baby front teeth? What is that sort of tooth fairy years where their baby teeth are in their front?
Sure. So the baby teeth in the front, they typically come in, the lower ones, lower central incisors will come in around 6 to 8 months. And then they will keep those baby teeth in the front until they're about 8 to maybe 9 years of age, with losing the maxillary lateral incisors the last.
Okay, and so you have between 6 months and 8 and 9, and that's where their baby teeth are in their front of their mouth for the most part. And then you said you can help assess. So tell me, what are the sort of severity levels? What are you asking? What are you asking parents?
Sure. So the first thing we want to ask to make sure whenever they have an injury, we want to make sure there's no head injuries. The teeth will come second if there's any head injuries. And so for those type of situations, we may ask them to seek emergency care, whether it be an urgent care clinic or at the hospital. But the head's all checked out and the patient's feeling fine, we can address the teeth. And so when we're asking parents what's going on, particularly for baby teeth injuries, we're asking about, were they able to stop the bleeding? Did the teeth look like they were moved in another position? Was it moved up, down, out of the mouth, pushed forward or backwards? Are they able to communicate with the with the parent what's going on. Eating and drinking, we're asking about those questions, if that's something they're able to do, and what their tolerance is. And the injuries can range from something as simple as a concussion, so a tooth may be just a little bit tender, to avulsion, which would be the most severe injury.
Okay, so so bottom line, if a parent's watching this, they suspect a head injury, forget the teeth, get to the ER for sure. What about a lip? I get that question a lot, like a torn lip. Is that managed by you, a plastic surgeon? Where is that managed? Do you sew up lips yourself?
We do place stitches or sutures, but I would feel most comfortable telling the parent if it's a laceration that does need stitches and the bleeding cannot be stopped. I would feel more comfortable sending that patient to a pediatric plastic surgeon for that type of treatment, because that is an aesthetic view, and I want to make sure that they're getting the best treatment.
Okay, meaning you don't want them to get scarred, a big scar on their lip. So head injuries, ER for sure. A lip, again, if it's late at night, you're probably going to the ER. It sounds like possibly. I mean, I don't know if you can find a pediatric plastic surgeon.
That would be ideal. Yeah.
And then so now you said depends on where the teeth are. Obviously, I was kind of giving that example of Julie because her son's teeth were just kind of loose. I asked her this week; it's getting better. So I kind of knew it wasn't a huge deal. But what are the tooth injuries that need to be addressed? I mean, in, out, totally out, sideways. Well, which ones, if a parent's watching this, are the ones that are like, okay, this is pretty serious?
Sure. So for most baby injuries, the ones that likely need immediate attention are luxation injuries. So baby teeth that have been maybe partially avulsed, so maybe we're seeing some of the root exposed, or they've been pushed backward in a position where they're unable to close their mouth because they have a traumatic occlusion. Those are instances where we would want to address the trauma pretty quickly. The sooner we can reposition the tooth or remove the tooth, the patient will feel a lot more comfortable. But most other type of primary tooth injuries, such as avulsion, the whole tooth is accounted for. We don't necessarily need to see them that same day. We don't reimplant baby teeth. Concussions, a tooth is a little bit loose. Those are all type of injuries that could be seen the next day if these are traumas that happen after hours.
Okay, so the one where it's pushed in and the kid is biting and he's hitting his other tooth, so he can't chew because every time he chews, that front tooth is hitting. He's crying and he can't eat anything or see. So that's high priority. If it's funny enough, if it's totally out, it's not as big of a priority. I really would have thought it was backwards. So you said something interesting. You don't reimplant baby teeth. So that leads us into what are you guys normally doing? A baby tooth, you don't put it back in general.
Right. The reason why we don't reimplant the baby tooth is because you're so close to the developing permanent tooth, and that's really our biggest concern. So by reimplanting the baby tooth, you could injure the developing adult tooth, which they're going to have forever. So there are some aesthetic things that we can do to replace baby tooth that has been lost in the front, but we do not put them back in the mouth.
Cool. Okay, and so if the tooth is lost, now you manage it with some sort of a prosthetic, I assume, something that comes in, or a bridge, or some sort of a baby. I mean, do you do you don't do like veneers and stuff like that, or maybe bonding? Is that kind of what you're looking at?
Yeah, sure. And whenever a patient loses a baby tooth in the front, the only reason to replace it would be for aesthetic reasons. So we're able to do pediatric bridges and things like that, but the only concern for it, it's more of an aesthetic issue.
Not eating, talking, speech, these are or development, these are not an issue on front baby teeth?
Right, not necessarily. There may be some transient speech delays, but typically there's no long-term speech issues.
Oh, wow. See, I would have thought otherwise. I'm assuming parents are saying, well, gee, I don't want my kid without, he has, elementary school photos, and you just kind of say, well, you can take some white out and put some in there, something like that.
Yeah.
And then I do know, of course, with adult teeth, and that's going to be another episode, that I know the management of adult tooth trauma is far different. So then how about this one? We've all seen, I've certainly seen, the baby tooth that turns black. It looks like a zombie tooth or something like that. So why is that? And, where does that come from? Can you prevent it, and how do you manage it?
Sure, now that's a good question. We see that all the time. Discoloration is very, very common after injuries to the baby teeth. And just because the tooth turns dark doesn't necessarily mean that tooth needs treatment. The reason why it turns dark is the hemorrhaging from the trauma that's getting trapped in the dentin tubules. Okay? Sometimes you'll see the tooth become very dark soon after the injury, and then the tooth may lighten back up. Baby teeth are very funny that way. Other colors that you might see are pink color, and that may be a sign of internal resorption of the tooth. Another color you may see is more of a yellow color, and that may be a sign of pulp canal obliteration, which is a sign that the tooth is still alive. It's almost like a natural root canal for the baby tooth. But because with the pulp canal obliteration, it has more of a yellow tone.
So, but either way, it sounds like the discoloration, whether it be pink, yellow, dark, you just leave it alone. You kind of just, you don't mess with it, or you don't treat it aesthetically, maybe if a parent wants you to put some bonding on it or something like that, but it's not like a sign of a serious problem for that kid.
Well, it needs to be evaluated to make sure there's not an infection present. And the best way to determine whether or not an infection present is a clinical exam. If you see a sinus tract or abscess associated with the dark tooth, obviously that's a sign of an infection.
What's a sinus tract? I'm sorry. What's a sinus?
Just almost like a little pimple.
Okay.
And, like a fistula or a little,
like a pimple. I know what you're talking about.
Yeah. Okay. And another way to evaluate the health of the tooth, if the tooth is dark, is taking an x-ray of the tooth and looking for a sign of infection around the root. Just because your child doesn't complain of pain and the tooth is dark doesn't necessarily mean there's not an infection present.
Got it. Okay, great. So, but these are all things that can be managed the following Monday or the next day. We've kind of taken care of the big players, but this is what parents can expect, the discoloration. And of course, they should, it's common sense. You have to get into a pediatric dentist, have them look at it, take an x-ray. Because you said something I feel is important. It's the adult tooth that has to be sort of watched out for. And if there's an infection or something like that, it sounds like you would take out a baby tooth, sacrifice the baby tooth so that the adult tooth doesn't get discolored or have problems and stuff like that.
Sure.
Okay, and it sounds like it's all just temporary social issues until they're 8 or 9 years old. Then they're going to get their adult teeth anyway, and they're back to good. Well, listen, I appreciate it. I do have one more question. I have to brag on you a little bit. I heard a rumor that you were the female gator mascot, Alberta, for 4 years, correct?
That's right, go Gators.
Now, here's the thing with that. This was in the years, the Gators were kind of on top of the heat back then. You were Tim Tebow years, correct? So, you had some pretty happy, cheerful crowds. So, here's my question. Currently, I don't think the crowds are as happy. So, would you prefer to be dealing with a hysterical parent with their child that just had trauma, bleeding, the parents flipping out, or would you rather be Alberta now dealing with the just as hysterical fans when they're losing 43-0 to, I don't know who it was, Mississippi State? Both would be pretty troublesome spots to be in. What's your preference?
Well, I was actually at that game last weekend, and I would probably say I'd rather deal with a parent.
So Alberta was not having a good day that day.
No, she wasn't. That was a sad day, but I'm still a Gator fan.
I'm sure you are. 25 years, however many years you spent there. Well, listen, Dr. Mansour, I really appreciate it. Very good bottom line stuff. I think every parent can benefit from watching this. Hopefully somebody learned something here. Please, if you have questions, comments, post it onto the YouTube channel. I'll constantly try to answer them, or probably better yet, try to send them over to Dr. Mansour to answer them for you. Thank you so much.
Yeah, no problem. Thanks.
Bye.